Do you have EOE? And is it causing your heartburn? That's what we're going to answer today. So, first of all, what is EOE? If you've been diagnosed with it, you've probably looked it up. If you haven't been and you don't know what that is, EOE stands for Eosinophilic esophagitis. Basically, it's an allergy causing an inflammation in your throat when you swallow. All right? So, when a doctor diagnoses you with this, they've run some blood work on you. So, when they test your blood work, they can look at there are different components within the immune system that are responsible for different things. Eosinophils are related to food allergies. They're also related to parasites, but in the case of this situation, EOE means that you are eating foods that you are allergic to that cause an inflammation in the throat, right? And so in this situation, you go to see the doctor, they run the blood work, and they test you for your eosinophils and whether they're low or high. And if they're high, then they say, okay, you've been getting heartburn, or you've been getting pressure in your chest, or you've been getting mucus in your throat, or you have this cough, or you feel like you can't swallow completely, or you just have pain, burning in this general area. They say, oh, you have EOE. So then they say, all right, let's just basically put you on a PPI, a heartburn medication, to help you with this EOE. They might, if you're lucky, say if they have any training at all on health and diet in medical school, and most doctors don't, they might say, well, you should probably avoid some certain foods. And if you do that, then you might feel better. But pretty much just stay on this PPI, and the EOE, we're just going to keep an eye on it and keep checking it. That is how traditional medicine handles EOE. Plain and simple. If they want to go a little bit further, they might recommend an allergy test. So they might look at the blood work a little bit deeper dive and look at what's called IgE. We'll talk about that more on a different video. They might also do a skin prick test, which will check your IgE responses to not just foods, but all kinds of different environmental allergens. But in this case, EOE and how it is caused is not always done by allergy. It's not always caused by an allergic response. So I want to make sure that you understand this in this video, because when you are diagnosed with EOE, you go down a certain pathway in traditional medicine, and that is the path. There is no deviation from that path one way or the other. It's this. And you have to fit into their box. Otherwise, they throw up their hands and they say, we don't know. So you need to understand this. This is important to understand. If you have heartburn, or if you have symptoms related to GERD, acid reflux, and you've been diagnosed with EOE, just know that going down the traditional medicine path can be challenging for you. So what I offer to my patients who have been diagnosed with EOE is a 15-minute to 30-minute free consultation on the phone. We want to know what the issue is going on with you and questions you might have about what we do in our office in terms of functional medicine for EOE. We can answer your questions, whatever those questions may be. We also want to make sure that what's going on with you makes you a good fit for our office. So just know that in the link to the description to this video, you can click on that and find a way to set up that free call to talk more about EOE and how we address that. All right? So if you're in that whole mix of traditional medicine and bouncing around from your primary to the GI doc to the allergist, and you're not really getting the answers you want, and this has been bounced around as far as a possible diagnosis, go to that link, click on that, figure out how to get a free call with me. Let's talk about how I might be able to help.